My name is Yana Shah, and I am a rising senior at Mills E. Godwin High School. Today, I will be presenting my project focusing on breaking barriers by expanding detox access behind bars. I propose a legislative solution to attacking the opioid epidemic. Before we begin, I would like to introduce myself a little more. I am an avid researcher that is passionate in both topics of medicine and public health. Additionally, I fundraise for the Leukemia and Lymphoma Society, and in my free time, I love to play with my dog, foster kittens, and hang out with my friends. Okay, so let's begin. Understanding opioid use disorder, or in short, OUD, and its effects on the body is crucial to understanding this bill's necessity. I want you all to consider a scenario where you have intense nausea, vomiting, tremors, and anxiety, alongside many of the other symptoms shown to you in the slide in front of you. Now, envision having these symptoms in a small, concrete cell with no support and no medication. This is the reality for 85% of people in prisons during opioid withdrawal, many of them suffering from opioid use disorder, a medical condition marked by problematic opioid use. As shown in this map, OUD does affect the entire world, but is particularly prevalent in North America and Asia, which is why our focus should be on these continents first. My interest in this topic grew after learning at a Harvard University camp in 2023 that the majority of OUD patients detox in jails. I found it perplexing why we as a community weren't focusing on the prison population to attack the epidemic, if that's where the majority of the patients lie. As I continued my research, I found that only 10 to 12% of jails in the United States provide detox drugs, hindering inmates' chances of recovery and increasing the risk of recidivism, which is the tendency of a convicted criminal to reoffend or return to the same criminal behavior after being released from imprisonment. This statistic is surprising, especially since the World Health Organization's guidelines recommends that incarcerated individuals should receive adequate health care and that opioid withdrawal treatment should be available in prison settings. Throughout my presentation, I refer to inmates as patients because OUD is a diagnosable disease. They deserve care and support like other patients receive. In most, if not all cases, taking a drug is not a choice, but a curse of brain chemistry, and both society and the government should take steps forward to changing the system and treating these individuals as patients who deserve a second chance at life. Despite the availability of more rehabilitation programs, the fact that 68% of individuals with a history of illicit drug use are rearrested underscores the need for alternative solutions. Research shows that those who began buprenorphine treatment in jails started post-release treatment in 3.9 days on average, versus 9.2 days for those who were referred to treatment after release. Additionally, 68.6% of inmates in prison methadone treatment and counseling enter treatment centers post-release, while only 7.8% of inmates who receive only counseling enter treatment. My proposed bill mandates Virginia correctional facilities to provide medication to inmates with OUD. This initiative aims to lower mortality and recidivism rates, yielding personal, societal, and economical benefits, as well as decreases the prevalence of public health issue. I chose Virginia because that is the state I live in, but this policy could be implemented in any of the states in the US as well as the rest of the world. Key points to this bill include allowing patients to start treatment upon entry and providing the drug at no cost. Additionally, all staff should receive training on opioid use disorder with the goal of minimizing the impact of stigma, dispelling tensions between security and medical staff, and improving patient care. This bill would start in the States, as the USA has the most cases of OUD, and hopefully inspire other countries to implement this plan in their jails so the crisis can be averted. While detox drugs may not eliminate all symptoms, they can curb cravings and discomfort, reducing the likelihood of relapse and recidivism. This policy offers not only individual benefits, but also broader societal and economical advantages. By reducing the risk of recidivism and drug-related crime rates, It can lead to cleaner, more prosperous, and safer cities. This includes a decrease in the prevalence of used needles on the streets and fewer criminals traveling from other areas in search of drugs. As a student currently considering colleges, one of my choices was Boston University. However, one of my main concerns for the school was its location. Boston, Massachusetts has one of the highest drug-related crime rates in the nation, and I wasn't sure if I would feel safe living in that city for 4 years. Not only do these factors drive people like me and students like me away, but they can also deter businesses, causing these areas to be economically disadvantaged. Therefore, our goal as a society should be to address this problem at its root by helping people through the use of detoxification drugs. I appreciate the concerns raised about this proposed policy, and here's how I would address them. By implementing detoxification drugs to reduce recidivism, we anticipate a decrease in the average cost per inmate per day over time. As fewer individuals return to jails, the associated expenses are expected to diminish, eventually reaching a point where jails can break even, possibly within the initial years of implementation. Moreover, recognizing the diversity in funding allocation across different regions in Virginia, we understand the need for flexibility. Jails will have the autonomy to allocate funds based on their specific requirements and the severity of the drug-related crimes in their respective areas. For instance, areas surrounding the Albemarle Charlottesville Regional Jail are characterized by higher grades in drug-related crime, may not require extensive investment in detoxification drugs. Conversely, areas around the Richmond Jail detention with lower grades may need to allocate more resources. To ensure an informed decision-making process, an educated working group would be established. This group will assess the unique needs for each jail and recommend the most effective approach tailored to their circumstances. These are my references for my presentation. And before I finish, I would like to thank my parents, my mentor, Nathan Perry, and the JHLC team for letting me present my topic to you. Thank you all for listening, and if you have any questions for me, please feel free to reach out to me on my LinkedIn or email me. I hope you have a wonderful day.